Okay, so let's talk about immune thrombocytopenic purpura. All right. So see, this is deficiency of uh, platelets. All right, and due to some autoantibodies. All right. So there is less production. Sorry, there is destruction of platelets. So this can be of two types. All right. It can be either acute and it can be either of chronic. So acute happens in 2 to 4 years of child, and chronic happens in 20 to 40 years of person. All right. So this acute happens after certain viral infection. All right. And it resolves within 6 months. Then after this acute has good prognosis, and it is also self-limited, means it becomes good by itself. So that's all about acute. Chronic has a bit of bad prognosis, and this is more common. All right. And then after, among the thrombocytopenia, this ITP, immune thrombocytic purpura, is the most common. All right. So now see what happens. So what sign and symptoms you will get to know that this is thrombocytopenia. So first thing, very simple, you can say petechiae. If you don't know what is petechiae, so in your body there is the small rashes like this, red rashes. All right. And moreover, you would have easy gum bleeding. All right. Might be some, if there is bleeding, it won't stop. Bleeding won't stop suddenly. All right. And some other symptoms might be, you may feel weakness, fatigue. So these are generalized symptoms seen in many of the cases, but it generally shows the symptoms which are related to clotting of the blood. So now let's talk about the pathogenesis. So if you talk about the pathogenesis, see, this is your platelet, all right, and it has two glycoprotein membrane. It has two glycoprotein in its membrane. One is 2B3A and another is 1B9. So these are two glycoprotein which is found in the platelet. All right. So your body start to generate autoantibodies against these two glycoprotein, and that is generally of IgG type. All right. So what happened? Your platelet is opsonized by IgG. All right. So once this platelet is opsonized, now it moves in the circulation and goes in the spleen. So this is hilum of a spleen, and in a spleen there is mononuclear phagocyte. This mononuclear phagocyte recognizes this opsonization IgG and this 1b2b complex. So after this there is a sequestration of this platelet, and by this way it keeps on destructing the platelets. Alright, so in 70 to 80% of cases after splenectomy the symptoms are relieved, but if symptoms are not relieved, then certain medications are given to control this antiplatelet phenomenon. Alright, so this is about the pathogenesis. So now what will happen in bone marrow? No, let's now talk about laboratory diagnosis, then we will see what will happen in the bone marrow. So in laboratory diagnosis, if you will check for platelets will be less than 80,000. Alright, it can be even less than 10,000 in some cases. And one more thing I want to make you know that if there is 20k to 50k of platelets, then it is post-traumatic. Means once you are wounded, for example, this is your hand, and if you will be wounded, then your bleeding will take longer. Alright, take longer to cure. But if platelet is less than 20k or in the region of 20k, then you can have certain petty keys like this, small round dots. So these are petty key. Alright, and if you have less than 10k platelets, then your central nervous system, alright, your central nervous system there can be CNS bleeding, and this is very traumatic. You might the patient might die. So less than 10k platelet is very dangerous. So what I have seen in peripheral blood smear, there will be less than 80,000 or sometimes less than 10k also platelets. Alright, then after if you talk about the anemia, if you talk about the RBCs, alright, so RBC might be, let's talk about hemoglobin first. Alright, so hemoglobin might be 7 to 12 gram per deciliter. Alright, and the RBC might be normoblast. So normoblast is immature RBC. So immature RBCs might be more in the blood, and platelets might be also immature. Alright, so immature platelets can be seen. Alright, and if you talk, so they are the things which will be seen in peripheral blood smear, and certain tests like tourniquet test, this will be positive. What is tourniquet test? So in tourniquet test, your hand is just get cuff of a sphygmomanometer. Alright, and pressure is applied. So it is made between your systolic and diastolic BP. So it is fluctuated between these. All right, and after certain time this is removed, so there will be more from that small spots, that is petechiae, will be seen. So tourniquet test will be positive in that case. Then after certain more live diagnosis results can be seen, for example PT. All right, PT and PTT time will be normal. There won't be any difference in PT and PTT. Then after, if you talk about the spleen size and lymph node size, they will be at the normal size. All right, so there won't be any changes, they will be of normal size. If they are just uh, if their size is increased, then diagnosis will indicate in somewhat other things, but not the ITP. All right, then after, these things will be seen. Moreover, yes, bleeding time will be increased. All right, so bleeding time will be increased. So these are certain diagnosis. Laboratory diagnosis comes these things. And now let's talk about the changes in bone marrow. Okay, so now first thing, what is happening? Platelets are destructing, so there will be megakaryopoiesis. So megakaryocytes megakaryocytes will be more, and that is both that is mature and immature. All right, then after, there will be erythropoiesis, so there will be increased production of normoblastic red normoblastic cell. So it is the one of the stage in the RBC production that will be more, means immature RBC will be more in general, in normal, if you understand normally. All right, and then after, if you talk about the white blood cell, if you talk about myelopoiesis, it will be normal. So what is myelopoiesis? Myelopoiesis is the production of WBC. So WBC production, and this is the progenitor of or formation of WBC. So formation of WBC will be normal, and as there is production of RBC in very in very fast or at higher rate, iron storage will be deficient. All right, iron deficiency will be there. All right, so once iron deficiency will be there, the RBC will be start to be formed. Microcytic normochromic anemia can be seen. All right, so these are the some changes which will be seen in bone marrow. So by this topic, we are going to stop our lecture right